Hello, I'm Bobby Savoy, AARP Louisiana State President. Did you know that donated blood is needed by a patient in the United States every 2 seconds? So let me repeat that. Blood is needed every 2 seconds. That's why today I'm speaking with Jay Thomas, who is the lab manager at the Our Lady of the Lake Blood Donor Services, to talk about the importance of blood donations. Jay, thank you for joining us today.
Thank you for having me, Bobby.
Great. So Jay, could you tell us a little bit about the Our Lady of the Lake Blood Donor Center?
Sure. We have a history that goes back about 70 years. We have been a hospital-based blood donor center supporting the needs of Our Lady of the Lake and the Baton Rouge community for that long. Back in 2005, we entered a new phase of with our organization, and we merged operations with Our Lady of Lourdes in Lafayette, and so that expanded our footprint to cover pretty much all of southeastern Louisiana over into south central Louisiana. And since that time, we've added a couple more donor centers. So we've really grown, especially over the past 16 years, to become one of the largest hospital-based blood banks in the United States. And those are kind of a rarity any longer. Most of the blood donor centers that people are used to dealing with are these standalone donor centers, which, they serve a great service to our healthcare community. But the thing that we have is we have both the patient and the donor here, and we can complete the circle. So when you've donated with Our Lady of the Lake Blood Donor Services or with one of our fixed sites in Gonzales at Our Lady of the Lake Ascension or Our Lady of Lourdes Blood Donor Center in Lafayette, you can rest assured that that blood is staying right here in our community and helping our patients, our families, our friends in their time of need. So that's what makes us unique at Our Lady of the Lake Blood Donor Services.
Yeah. So, it's been reported in the news, and my understanding is Baton Rouge is experiencing the worst blood shortage in 25 years. And I guess if Baton Rouge is experiencing that shortage, it extends also to some of these other partners that the lake partners with. Is that right? And why is that? Why is that blood shortage so critical right now?
Well, actually, Bobby, this is a nationwide issue right now, and so obviously we're focused on efforts to help revive donor collections in our area to meet our patients and our family and our community's needs. But the problem is that the root cause of this latest shortage is really began back in March of 2020. And I think everybody knows what happened then. COVID came along and changed everybody's lives. And certainly we're not immune as a healthcare facility to the effects of that. People got really scared when COVID came out, and they started staying home and trying not to go out and expose themselves any more than they've had to, and that's the first cause is that caused an immediate 20% drop in our collections, 30 up to 50% in some other areas, and then you couple that with hurricanes that we've experienced over the past year, and of course this latest weather event with the ice storm, and people were absolutely at home and no one was coming out to donate blood, which is completely understandable. We have to be concerned about the safety of our donors, but we also have to provide for the needs of our patients. And that's why we're encouraging everyone to come out and donate now. Help us provide those inventories for all those, for not only for Our Lady of the Lake, but all of the hospitals we serve, and help put our hospitals in a position where when we do have friends and family that come in and need our services, we can provide those with confidence.
So I understand the compounding factors of COVID, and then people staying home, and then the ice storms, and then more people staying home, and people reluctant to go in and do really anything. So even with the reduction in the number of people that are donating blood, I mean, do you see any little light? I mean, is there any just like slight improvement in, people coming to donate? I mean, are they still concerned about COVID and, being in crowds and, doing those
Right.
things?
So once the weather cleared last week, we did start to see an improvement in collections, and we have recovered somewhat. We're still not at a comfortable level of inventory, where we'd like to have about a 3 to 4, maybe even a 5-day supply of blood on hand. Currently, we're probably at about a day and a half, 2 days of blood on hand, which is a lot better than where we were. So we have seen some improvement. And if I had a message for everyone that's concerned about, exposing themselves to COVID, we're just like every other facility. We've had to learn to adapt our practices since March of last year. And we were actually the first department in our hospital to adopt precautions, because we knew that our donors were going to have concerns about getting out. So we have all of our protective measures in place, social distancing, and asking donors when they come to bring a mask and wear it, providing disinfectants for people to clean their hands, and making sure we clean between donors to keep everyone comfortable and keep the blood donations as safe as possible for them.
So Jay, why do you think it's so important that we have blood donations? Like, who benefits from those donations? What kinds of patients, and how much blood they might need? I know that's a lot of questions there, but basically important for blood donations, and who benefits?
Okay, well, I'll break this up into a few different categories, because certainly there are many different types of patients that come into our facility, as well as other hospitals, who need blood transfusions for different reasons. So I'll give you some of the major ones. Number one would be traumas. These would include motor vehicle accidents, gunshot wounds, knife wounds, any patient that might come through the emergency room that needs immediate transfusion due to a massive blood loss. Number two would be heart surgeries. Sometimes when a person is undergoing heart surgery, and probably Bobby, a lot of the people you represent through AARP fall into this category. They have heart conditions and they may require surgery, and those tend to use a lot of blood, whether it be red cells or platelets to help stop bleeding during the procedure. So that would be number two reason. The third reason is cancer. People, we have a high number of cancer cases in Louisiana. We service Mary Bird Perkins Cancer Treatment Center here at Our Lady of the Lake. And we do a lot of chemotherapy and radiation therapy. And these patients need a lot of blood products to support them as they progress through those therapies for cancer treatment. So there's many other reasons why someone might need blood, but if you're talking about the three main uses for blood in our community, those certainly represent the majority of transfusions through our facility.
Okay, that's, you know, and it's unfortunate. We do represent that segment of the population of older adults, and I guess if we live long enough, all of us will need those services at some point in the future. So, can anyone donate blood, and how much time does that blood donation usually take?
Okay, so anyone in Louisiana, people as young as 16 years old can donate. At 16, the state of Louisiana allows those donors to donate with parental consent. Once they turn 17, they can donate without parental consent. And there's no upper age limit, Bobby. You know, a lot of people think, well, you know, they don't want my blood, I'm too old. That's not true. You know, your blood cells don't know your calendar age. Okay, so the life cycle of a red blood cell is about 120 days from the time your body creates it to the time it gets rid of it. So at 81, your blood cells are just as good as they were at 16. So we have other health factors, obviously, at 81 that play into eligibility. And but some of the common questions I get, especially from my elder population, is like, well, I got diabetes. You don't want my blood. That's not true. Or I've had a history of cancer. Well, that's not true either. If you've recovered from cancer for over a year, barring certain types like leukemia and lymphoma, you're perfectly healthy to donate blood. Or I've had a heart condition and I don't feel like it's safe for me. Well, we take all those things into consideration when a person comes in to donate blood, and we ask there's a very thorough screening process. We do a mini physical to determine a donor's eligibility, because when we're doing that, we're not necessarily just looking out for the safety of our patients, we're looking out for the safety of our donors too. So if you come in and you get screened and we determine that it's not safe for you to donate blood, we're going to thank you for coming in and encourage you to send others to donate, but we'll let you know you just do not fit the profile and it's just not safe for you.
Good.
So they
Well,
have a lot of confidence that we keep our donor safety first and foremost in our minds.
and what I'm happy to hear about is that blood doesn't know our age.
That's right.
That's a good thing. So, having said that, how often might someone be able to donate blood?
So regular whole blood donation, someone can donate every 56 days or every 2 calendar months. Platelet donations are very important to support our chemotherapy patients and our heart patients. And you can actually donate platelets every 3 to 7 days, up to a maximum of 24 times in a year. And some of our donors that come in that are they're like family to us because we see them so often. They just get committed to it. You know, they like the feeling of being able to come in and help someone. You talk about, I always tell my team that we serve another purpose. Besides caring for our patients, we give our donors an opportunity to come in and sit down and really make a difference in their community, but through a very simple process. And when they leave, they can feel good about themselves that they've come in and they've given something that's going to save somebody's life. And there's some value in that. So if you know of someone who could use that type of encouragement in their life, get them to come donate blood. It's easy, and it's an easy win.
So, coming back to the process, how long does this take to get how much blood you're gonna take from someone?
Okay, you can look to spend about 20 to 30 minutes with us for a whole blood donation, and that includes the time to get registered at the front desk, to go through the screening process and the collection process. So look to spend about 20 to 30 minutes with us. If you're going to donate platelets, we do encourage you to call ahead, make an appointment, because you can plan to be with us about an hour to an hour and a half for that donation.
So, it seems like what we've talked about, who can donate, how often they can donate, who needs the blood, and that kind of thing. And that it's a, 20-minute, 30-minute operation, to donate blood. So it sounds like a pretty easy process. And as I don't know if luck or happenstance would be the right word, but we actually just had one of our AARP Louisiana employees who donated this week. He's our director of advocacy, Andrew Mull, and I know we thank him for his donation. And so it's been a great conversation, and I hope that it inspires our listeners to increase badly needed blood donations. So if someone might be interested in donating blood at Lady of the Lake Blood Center, what should be their first step?
Just know that during this time of COVID and our safety practices, you don't need an appointment, but an appointment is encouraged to make sure that we can maintain social distancing requirements. Bring a mask and wear it. Eat a healthy meal. Drink lots of water the day before you intend to donate blood. That's going to help ensure that you don't have the very feared reaction that some people do to donating blood. So I always encourage you to eat a good, healthy meal and drink lots of water before you donate.
So before we wrap up, any last minute thoughts first, and then if anyone has a question or they need more information, how can they contact you?
They can reach out to us by phone or contact us through our website. If you want to give us a call, you can give us a call at 225-765-8843. And we'll be happy to answer any questions that you might have for your specific situation. If you feel like any of the things that we discussed today don't answer the questions that you have or the concerns that you have, feel free to give us a call and we'll talk about any of those details.
Great. Jay, thanks so much for taking the time to talk with us today and our members. And I hope through this conversation, I'm going to bill it as a public service announcement, to our members and whoever our viewers are, that we're able to increase our blood supply so that we can save additional lives.
I appreciate the opportunity to speak with you, Bobby, and I look forward to seeing you guys come out and donate.
Great, thanks. So in closing this conversation, I'm reminding our listeners to stay safe and remember to be respectful of others. Continue to wear your face covering. Keep 6 feet of distance between yourself and others. Wash your hands often and stay home if you're sick. Together, we will get through this pandemic, and we can help to increase our blood supply by donating. So until next time, thank you for joining us, and goodbye.